Well, while most of us are thinking in our hearts, of our hearts in this Heart Health Month, many may not be aware of how important a specialized type of cardiologist could be in cancer care. Senior health correspondent Monica Robbins is joining us now to explain what cancer survivors and those going through treatment need to keep in mind.
You know, it's interesting you were talking about all the smoking and the tobacco. Of course, lung cancer comes to mind. So many people may not even be aware that there are cardio-oncologists who may be part of their cancer team. These are doctors who make sure the patient's heart is strong enough to endure cancer treatment, and this can be very important for those going through radiation therapy for lung or breast cancer when the radiation could be near the heart. Now, the other reason is the aftercare, because cancer patients are twice as likely to die of heart disease than the general population.
One of the best things that we can do in order to curb these cardiovascular adverse events is to monitor closely and risk stratify patients who are highest risk for developing these potential adverse effects, monitoring closely and intervening early, with the goal being to minimize the likelihood of cancer treatment interruption.
So experts say it's really important for patients to be aware of the risks and to advocate for themselves by seeking the care of a cardio-oncologist who has the expertise to consider how the heart health works in tandem with cancer care. Now, we are fortunate here in Northeast Ohio as our major health systems do have cardio-oncologists on staff. And it's great if your oncologist brings one onto the team, but if you have a history of heart disease in addition to your cancer, you may want to request a specialist in cardio-oncology.
It takes a village, doesn't it, Monica?
It really does, and it takes people to speak up.
Yes.
And say what they, at least ask questions.
So patients would be allowed to ask?
Sure,
you can. For a cardio-oncologist?
Absolutely. Ask if one is necessary in their care, because we know that chemotherapy, radiation, even immunotherapy has an impact on the heart.
Sure.
So this is definitely something patients at least want to bring up in discussion.
All right, good news. Thanks so much, Monica.